pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, everybody for coming. Need approval of the minutes.
So moved. I'll second them.
All in favor?
Aye.
Opposed? Motion carries. Read the resolutions. HE1, resolution authorizing budget bond transferring insurance recovery funds to Healthy Family Program. Turn that over to you.
Motion second.
Oh, gotta have a motion.
So moved.
Second. Thanks, Phil.
This is a resolution requesting authorization for a budget modification to transfer insurance recovery funds to the Health Families Program. On December 15th, a vehicle assigned to the program was involved in an accident. An insurance payment in the amount of $2,357 was received and will be used for the repairs costs.
Motion to discuss.
Not repaired yet?
No, I think it is. It just, it wasn't really spent in the other 2000.
What's there, what?
Mr. Carter, you kind of answered the question for me already. It's carpet repaired.
Yeah, it was just pretty much scratching that. I think
Oh,
it was
okay.
not too much of a big deal for 2000.
You're right, you're correct. It's a thing nowadays. Thank you.
You're up.
Anybody else? All in favor?
Aye.
Opposed? Motion carries. HE2, resolution authorizing increase to capital project number 134. This is a yearly thing. We do it every year, and it's for the Silk Road Remediation Reserve. Motion to discuss, first by Richard Klein, legislator Klein, second by legislator Togwell.
This is a resolution requesting authorization for a budget modification to increase the capital project 134 to $124,765. This is all funded through the transfer of capital reserve as approved number 195 Silk Road Remediation Reserve. This is done annually to support ongoing operations, maintenance, and regulatory compliance. I did hand out, it did say that this was cash, and it was not, I apologize, but it did hand out a breakdown of the costs.
That was for the amount of $104,765.
That's correct.
Will that cover us for the rest of the year?
Absolutely.
So the number on here is 224, 250.
That's total, because we already have 100
There's already money in
in there.
there. And since this is an annual recurring expense, why is that automatically budgeted expenditure?
Because we really don't know what we need until around this time every year. It's the honest answer. Last year, we did have an EPA final review, and the contract with B&L was up, so we received a new contract for them, so the cost went up a little.
Mr. Chairman,
Yes.
may I add to that, there's a structural issue as well, in terms of budgetary structure. This work is done under an EPA consent order, which requires everything to be separate, so it's ongoing, it's been going ever since I've worked here. So we keep a Silk Road reserve that we recapitalize every few years with $500,000-$600,000. And then we have a capital project, when we move money from that reserve in every couple of years for what we think is what the anticipated cost for that year. So it needs to be, it's separate from the annual budget because this is a multi-decade really project. So it's not on the tax, and that way it also keeps all the accounting and ledgers for separate from the budget. So the money isn't mingled in other contractual accounts. It's a self-contained budget.
So I'm not familiar, is it Brownfield site?
It's the old,
It's
it's
a
the
Superfund
old.
site.
I was gonna
It
explain that. Go ahead.
You want me to give you a little?
Yeah, go
history?
ahead.
Yes, because there's the ones that.
I know.
Yeah.
Because
I
I was
know.
gonna wait until he was done. and I was done.
I know, I didn't
Yeah.
know too.
Yeah.
So, Silk Road is a landfill formerly known as the Volney Municipal Landfill. It's operated from 1969 to 1983, and it's now a closed Superfund site under the U.S. EPA and the New York State Department of Environmental Conservation. That oversight is due to the past disposal of hazardous material that contaminated groundwater, surface water, and sediment. While this site is capped, and it's been capped since 1985, it still remains controlled. It is not suitable for unrestricted use and requires long-term management, including cap maintenance, leachate collection and treatment, landfill gas control, and continuous environmental monitoring.
Now until forever, right?
For now,
Yeah.
until, yeah, through my lifetime anyway.
So basically, this site was before the Bristol Hill
Yes,
landfill.
absolutely.
So if anybody needs to know where that Silk Road is, if you know where the airport is, you go down through that side road behind the airport, you'll see all these white pipes sticking up out of the ground. That's Silk Road.
That's the old one.
Anybody else?
Cover my answers. I just wanted everybody to know because
No, yeah,
it's by the airport.
yeah.
So, good to know there's-
I figured you'd
Since
want
I
to
was a
know a
kid.
little history.
Oh, yeah. No, that's good. Thank you.
All in favor?
Aye.
Opposed? Motion carries. Committee review and decisions. Health Department updates.
I do have an update, because I want to give information about the discontinuation of the traditional public health rankings. That issue has come up a lot about public health rankings and where we stand. So I just wanted to give an overview of that real quick, and everybody gets okay with it. So for more than a decade, counties were ranked from healthiest to least healthiest, based on a composite of health outcomes and contributing factors. However, beginning in 24-25 reporting cycle, the program eliminated ordinal rankings and transitioned to a health group model, which places counties along a continuum of health rather than assigning them a specific rank. New York State continues. Counties are no longer being assigned a pneumatic public health ranking through the County Health Rankings and Roadmaps program due to a national shift in the methodology and reporting approach. The last single ranking was done in 2023, and we were the 49th out of 62 counties, but it did not reflect the true local conditions or progress. Rankings masked critical issues like rural access barriers, workforce shortages, and substance use trends. This change was made for several key reasons. A single numeric rank can often oversimplify complex public health conditions and embellish small differences between the counties. Rankings can often lead to unintended comparisons or stigma rather than a constructive action. So the new model focuses on trends, root causes, and actionable community conditions rather than competing us against other communities and counties. So updating measures now better reflect social determinants of health, healthy community, and the well-being and equity. So the underlying data has not gone away. They're still collecting it. So counties can still access a comprehensive health indicators for planning, grant writing, and policy development. This can be found in the community health assessment and our improvement plan that is on our website that I alluded to last meeting. And the shift is now about how the data is presented, and we're moving from the ranking system to a more nuanced, actionable framework. which is wonderful for us. I used to present here the county health rankings and the roadmaps data, but since it's changed so much, and it was never a clear indicator of the health of the county. So I think they've made good changes to that program. Any questions on
Thank
that?
you.
And then I did want to let you know that the RFP for the new mosquito station was posted in March, and we received one response that we are very happy with, and it was going to be brought to this committee, but I did run out of time, to be honest with you, so it will come to the June meeting for approval. And that's really all I got.
Thank you, Vera.
Bringing it to the June meeting, will that allow time enough for this to be installed for this year?
Absolutely. And that's part of the plan. And when they did the site visit, we kind of said that right after mosquito season is when we'd like this put in, and everybody was agreeable.
Okay.
And the well has to go in too, and that's when we need to do it, is during that time, because there's certain times of the season where they won't let you do construction anyway, so it kind of all falls into place. Is anybody else really hot in here?
We had to win.
I realized I have dripping.
Air conditioning won't be on until what, next month?
It's warm.
No, June. No, it's really well. Anyways, so the health update, is that into your director's report too, or do you have another report on that?
No, that was my update.
I just need to comment. I'm glad to hear that the measurements are different, because rankings do mask so much.
Thank you.
And people can just say, can diss the process, the good stuff that's happening. And
Absolutely.
and also, as you said, does not indicate all the reasons for the issue, why you get that low ranking.
Right.
And so, thank you for the update. I'd like to learn more about what's happening.
That's good.
Sure, Walker.
Yes, I just have a comment to make, and we have our chairman here, so it kind of directed to the whole committee. Social services, the committee, I asked the chairman a month ago, because the committee goes on for so long, and it's a very busy committee. I asked him if we could put social services on with health, because if you look, we've been here 15 minutes and our meeting's over with, and he was going to get back to me, whatever. But I just wanted to bring it up to the committee that it would be nice if we could relieve some of the busyness of that committee, maybe add it to ours or whatever the chairman decides.
Right.
Well,
we've been talking about it, a couple
Okay.
of us have been talking. So
Yeah.
I'm not saying it's off the table.
No,
but it's-
I just wanted to bring it up to the committee so we, they kind of might have had a little information about it.
Let's figure it out.
Yeah, years ago, it was together. And that was a long, and a lot of stuff that we covered, because they were rushing to get people out of here.
Sure.
I mean, it was almost the end of their day. So that's why it broke down and broke apart. Yes, we could do some realignment. I feel very confident about that, and I'm sure that's being looked at.
Yeah, I just wanted to bring it up to the committee, but I know that some of the ones that are on that committee are complaining that this, we could just mention, so no problem. Just wanted to bring it up to the committee. That's all.
And that's why we extended EDP and CAP.
Yes.
Because we were pushing to get people, we need our updates from our departments. And it was either switching this to 9 o'clock and then moving back, and I said, why don't we just do another half an hour and see what sticks?
And maybe not social service, maybe another committee that is fine. That, like I say, in 15 minutes we're done. So I think we could maybe help one of the other departments or something if we could, for whatever you decide.
For someone who's been here a while, it ebbs and flows. When we first split health off from the DSS committee, I remember, and especially during COVID, health committee was the committee that was going for a long time. So it depends on what's going on. You're right. Lately, meetings have been very short, but just a couple of years ago, they were.
Nothing happens. I just wanted to bring it up. That's all.
You can stay longer.
The other committees, I can't remember all the different ones, they also go long. I mean, to hear the reports of all these others, because I was timing, the social service was only about half an hour. But the other ones also went a long time. So if you just took social service out, I don't know what you call the other group.
And part of it is when you're grouping legislative committees, you want them to be covering similar departments. That's where the balancing
But
act
you,
comes.
but youth and Office of the Aging and I'm trying to remember the other ones. that are-
Veterans.
Veterans. They have their independent departments. And so yes, they're all related. And why not keep those together and just put social service in one?
They do work with social services.
I know, I
Yes.
understand.
It's kind of like
I'm a
infrastructure.
newbie. I
Anybody
haven't
done
seen
infrastructure? Anybody in here on infrastructure? Sometimes infrastructure, we're out in 20 minutes, and there's times that we'll be here at least an hour. We never know from month to month. I remember last year, health, was it June or July? We didn't even hold a committee because there was nothing. So, yeah, we did it 2
To
months.
Jill's point, I mean, I hope we never get a COVID scenario.
Mhm.
Oh, no,
For those during that time frame, these meetings were 2.5 hours.
Yeah.
So, I mean, we'll look at it, but it's like yellow, you're gonna push it here, and it's like, oh, here. So,
Just, yeah, thank you.
Sounds like either way, it's got to be.
And I'm going to say, because now, out of your EDP committee, and all the people that are involved, I'm going to say your health department is, just, they take care of us.
So here are the messages, get busier, so
I
this
know,
committee is more.
I know.
Or talk slow.
Well, if anybody hasn't had a chance to sit down with our department head from the health department, I encourage you. It was a learning curve for me. We timed out an hour, and I think it was a little over 2.5 hours before I walked out of the office. And I was like, couldn't believe it. All the stuff that she was, and I'd been here for 7 years, and I didn't realize, because I'd never been in this.
If you would like me to bring some of my department heads here to talk about each individual program, I'm more than happy to do that, even 10, 15 minutes.
I would love that. Yeah, that'd be great, especially, the one that I've been talking to you with, here with, the health, how the health department
Yes.
goes around the different restaurants and things of that nature.
We
would
can
be-
definitely start with environmental.
Yes, that would be great.
Great,
Anybody
Yes.
else?
thank you for that.
Motion to adjourn.
Motion to adjourn.
Second.
Oh, you have to vote for the fair housing, the drawings downstairs. There's, I think, Jackie, do you have the stickers? And they gave them out earlier.
No, Carolyn has them.
Oh, Carolyn has them.
And there's some down the pictures too.
It's the fair housing, art competition, and they want you to put stickers on your favorite.
That's usually held in the EDP committee, because that's under tourism.
I know, but I thought all the legislators got to do it. That's why I
Well,
just,
they go down and get their own stickers. We're lucky we had ours.
okay, well, I just wanted to support the thing because, you know, a kid who wins an award feels so cool. You know.
Well,
Version of early voting.
You know?